Thank you very much. As you've heard, my name is Sylvia Wamohu, and I am the Desip director. She's mentioned about family planning, and Desip is a family planning program funded by FCDO. Yesterday you heard that FCDO funds the largest family planning program in Kenya. This is it, Desip, and it means delivering equitable and sustainable increases in family planning in Kenya. We focus on poor rural women, youth and adolescents, and persons with a disability. Indeed, we don't like leaving anyone behind, and there's just a general thinking that persons with disability don't have sexual and reproductive health needs, but they do. So we make sure that we also include them in our program. So Desip works in 12 counties that used to have, I'm using past tense, because now we have improved with the new KDHS results, low MCPR of less than 45%. But now we have seen, due to our work, other partners in the counties that we work, and of course in conjunction with the Ministry of Health, there has been a lot of improvement, and we're very proud of the work that we have done in the counties. So our focus has been to just ensure that women are aware of family planning, and just talking about the interlinkages, because you mentioned about the interlinkages of family planning and maternal health. And that is why I'm here today. I'm sure, of course, when you have family planning, we'll be focusing on maternal health. I'm very happy to be here today, because we know that family planning is critical in reducing high-risk pregnancies and births. Why do I say this? We all know that we have cases of unwanted pregnancies. And when we have such cases, some people opt to take unsafe abortion, and that can lead to death. I wish they had taken a family planning method. We also have early marriages or early pregnancies. And the girls, we know that in Kenya we have teenage pregnancies. Their bodies are not exactly ready to give birth, and they end up getting into complications. So again, if they were aware of family planning, since they're already sexually active, I wish they had taken a family planning method. And of course, birth spacing. In the morning during the session, we heard that in some communities, some people do not want to take cesarean sections because they want to have 15 kids. If they were to space, maybe within the 2 years that is recommended, that would take 30 years to get the children, isn't it? So, of course, we would recommend, part of our work is to tell them, don't get 15, at least get 3 or 5. But you can imagine, if they don't space, that woman will be so frail in terms of nutrition, in terms of health, and even the babies that are unborn and the ones that are born, then they'll also be affected. So you can clearly see how family planning is linked to preventing maternal deaths. It is all about the work that we do under family planning, but of course, integrated with all many other things. So getting a little bit into the Desip work, just to show you how we come in, we start right from the bottom, whereby we go to the community level, then we think about the health facilities, and of course we work with the national and county governments. So it's a bottom up and at the same time top bottom. But very briefly, at the community level, at the beginning of the project, we developed social behavior change communication strategies with each of the counties that we support. We did this because we know all the counties are very different. What works in Homa Bay will not necessarily work in Wajir. And we use this to guide our intervention. We work with demand creation agents to implement those strategies that we came up with. And just to give an example, we really utilize the community-based distribution model, whereby the community-based distribution models go and meet the women in the houses. At the community level is where you meet a pregnant woman who is in their 3rd trimester. And this woman definitely need to take up an FP method after giving birth. Today, postpartum family planning is very important. Before that woman leaves the health facility, and we've heard from LSTM that they are really doing a lot to train these healthcare providers to offer high quality services. But can they also offer family planning at the point that they're leaving the health facility? So like when this woman comes to the health facility, then they have also moved to another stage whereby they can accept to take family planning services. So we make your work easier. You have a qualified healthcare provider, and we are giving you a woman who is ready to take up an FP method. Similarly, we have women at the community level who've given birth, but somehow they did not take up a family planning method at the time of birth. So we really talk to them so that they can go and take up the family planning methods. And also, sexually active women who are just confused, they don't want to get another baby, but at the same time, they don't know about family planning. Very briefly, about what we do at the health facility level, it is all about quality improvement, and this is where we train our healthcare providers on postpartum family planning. We ensure they have the right equipment, and very importantly, that the commodities are available. We also just use the same approach, structured mentorship, so that organically, these skills that we build on our healthcare providers can keep moving from one health provider to another. At the national and county level, it's all about policies, so that we can be standardized in our implementation, so that we can have guidelines and ensure that there's continuity and sustainability in our interventions.